Vancouver's drug policy conversation in 2025-2026 feels like the city itself. Rain slick, intense, and impossible to ignore. On one block, you'll see memorials and community outreach. On the next, you'll hear anger about disorder and fear for kids in parks. And hovering over everything is one brutal fact. BC's crisis is driven by an unregulated, poisoned supply, a reality that has pushed Vancouver and the province into some of the most progressive and most contested drug policy experiments in North America. Progressive, but not anything goes. When people say progressive drug policy in Vancouver, they often mean two intertwined moves. Decriminalization of small amounts of certain illicit drugs for adults, not legalization. BC's federal exemption began January 31st, 2023, and continued shaping enforcement and public space rules through 2025. Safer supply, prescribed alternatives, providing pharmaceutical-grade alternatives to reduce overdose risk from the toxic street supply. Health Canada describes safer supply as prescribed medications for people at high overdose risk, designed to reduce harms rather than requiring abstinence. Vancouver's stance isn't new. The city has publicly advocated for regulated supply for years, framing it as a preventable death issue. But the 2025 to 2026 window is where the story sharply pivots from expand access to tighten controls. 2025, the tightening begins. By 2025, the abstract debates around safe supply were over. The province was now deep in the practical, messy work of rewriting the rules for how it's delivered. The initial, more flexible approach had run into complex realities on the ground, prompting a significant policy pivot toward greater oversight and control. The era of experimentation was giving way to a period of intense regulation as officials grappled with the program's real-world impacts and unintended consequences. A key shift was the mandate for witness dosing or supervised consumption for prescribed alternatives. This meant patients would now take their medication under the direct observation of a healthcare professional. Professional guidance and provincial policy updates in 2025 focused on transitioning clients from non-witnessed to witnessed dosing, a move intended to ensure prescriptions were used as intended and to provide immediate clinical support. So, why the clampdown? The government and critics pointed to growing concerns about diversion, where prescribed pills were being resold or traded on the street. This was compounded by intense political pressure around visible public disorder. Here, Vancouver's progressive identity collided with a very local reality. Residents wanted both compassion for those struggling with addiction and the basic expectation of safe, functional sidewalks. It was a tension that defined the city's ongoing struggle. The biggest headline for the 2026 calendar year is a significant shift in policy. Stricter witness dosing requirements became the default posture. This change followed months of public debate and pressure to address concerns about the existing program. In late December 2025, the BC government issued a firm policy direction requiring nearly all clients on prescribed alternatives to transition to daily witness dosing by the 30th of December 2025. This meant clients now had to visit a pharmacy or clinic every day to take their medication under the direct observation of a healthcare professional. Limited exemptions were available, but the supervised model was now the clear baseline for 2026. Media coverage at the turn of the year immediately captured the polarized reaction. Policymakers framed the move as a necessary step to reduce the diversion of prescribed medications to the unregulated drug supply. On the other side, critics, including many clinicians and people with lived experience, framed it as a significant step backwards. They argued it would create major barriers to access and disrupt the stability crucial for people rebuilding their lives, potentially pushing them back towards the toxic street supply. With such deeply divided opinions, the central question became clear. What does the evidence say so far? Here's where it gets complicated in the way Vancouver issues always do. The debate over safer supply is deeply polarized, and the scientific evidence is often caught in the crossfire. Finding a clear, universally accepted answer is a challenge, as the data itself can be interpreted in multiple ways. Broad reviews of safer opioid supply programs often find potential benefits for participants, such as reduced overdose risk and improved connections to healthcare. However, these same reviews also emphasize significant limitations in the evidence and highlight ongoing concerns, particularly around the diversion of prescribed medication to the illicit market. A major U.S.-based medical journal study on BC's safer opioid supply policy reported increases in safer supply prescribing. It also found an association with increased opioid-related poisoning, hospitalizations, a finding that became fuel for critics, and a stark reminder that real-world systems can produce mixed and sometimes contradictory outcomes. This complex picture is why comparative work continues to evolve, with high-profile public health journals slated to publish more findings in 2025. The research community is still actively testing what outcomes look like over time, especially when measured against other established treatments for opioid use disorder. On the implementation side, scholarship in 2026 is still unpacking how BC's risk mitigation origins shaped today's prescribed alternatives reality. Useful context for why the policy keeps being redesigned. Meanwhile, the province itself points to scale and system building. For example, BC reported 3,120 people receiving prescribed alternatives in June 2025, a sign this is not a niche pilot anymore. The social media mirror, harm reduction pride versus enough already. If you want a snapshot of how Vancouver actually feels about all this, you won't find it in a policy PDF. You'll find it in comment sections. On Instagram, harm reduction pages and creators frame Vancouver as the place that pioneered compassion, asking why policy is moving backward and defending safe supply as a life-saving response to poisonings. On the other side, political figures and commentators post bluntly about diversion and argue that witness dosing proves the earlier approach failed. That split is the heartbeat of Vancouver's 2025-2026 drug policy era. People broadly agree the toxic supply is killing neighbors, but they disagree, sometimes violently, on whether the answer is more access, more structure, more enforcement, or all three at once. So, is Vancouver still progressive on drugs in 2026? Yes, but it's a more conditional progressivism, still anchored in public health and harm reduction, yet increasingly shaped by guardrails, supervision requirements, and the politics of public space. The city and province are trying to do something incredibly hard: reduce deaths and restore public order and maintain dignity, while the drug supply itself keeps mutating faster than policy can keep up.